My name is AM. I'm a second year medical student of Southwestern University, FINMA. I am going to conduct a musculoskeletal examination and everything will be video recorded. Would that be okay with you?
Yes, Doc.
May I know your name, please?
I am Leonardo Vittorio Rodrigo, Doc.
Okay, as proof that you agree with the video recording, may I ask for your signature?
Yes, Doc.
Thank you very much, Leia. Examination. We will first palpate with your muscles of mastication. Tell me if you feel any pressure or pain while I palpate, okay?
Okay, Doc.
Can you please clench your teeth? Very good. Please try to open your mouth. Okay, very good. Okay. In the TMJ syndrome, there is pain and tenderness while palpation. While I palpate. Do you feel any pain or pressure?
None, Doc.
Okay. Okay, now for your temporomandibular joint range of motion, I will be asking you to open your mouth, please. And close. Okay, open it slightly. Then try to move your jaw from side to side. Do you feel any unusual or pain, pressure while doing it?
None, Doc.
Okay, thank you. So now I will inspect your shoulder and shoulder girdle first, then anteriorly, then after is posterior. Can you turn or off? Okay, thank you very much, Leo.
Game.
Now for your shoulder girdle range of motion, we will start first with flexion. The principal muscles affected by this movement is your anterior deltoid, pectoralis major, and coracobrachialis, as well as the biceps brachii. Can you please raise your arms in front of you and over your head, Leo? Okay, thank you. Now for extension, the muscles affected would be your latissimus dorsi, teres major, posterior deltoid, triceps brachii. Can you please raise your arms behind you? Okay. Now, for the abduction, the muscles would be the supraspinatus, middle deltoid, serratus anterior. So please raise your arms out to the side and over your head. Okay. Now, for the adduction, the muscles affected would be your pectoralis major, coracobrachialis, latissimus dorsi, teres major, and the subscapularis. Please cross your arm in front of your body. Okay, thank you very much, Leo. Now, for the last two, the internal and external rotation. Now, for internal rotation, the principal muscles affecting the movement would be your subscapularis, anterior deltoid, pectoralis major, teres major, and also your latissimus dorsi. Okay, Leo, please place one hand behind your back and touch your shoulder blade or your scapula. Okay, thank you. Can you please face front? Now, for the external rotation, the muscles affected with this movement would be your infraspinatus, teres minor, posterior deltoid. Please raise your arm to your shoulder level. Then bend your elbow and rotate your forearm towards the ceiling. Okay, very good. Thank you very much, Leo. Do you feel any pain or any difficulty in all those maneuvers?
None, Doc.
Okay, very good. We will now do the two composite tests. First, the external rotation resistance. Please adapt and flex your arm to 90 degrees and I will apply pressure as you try to externally rotate your wrist.
Okay, Doc.
Okay. Pain or weakness during this maneuver is a positive test for an infraspinatus disorder. Limited external rotation points to glenohumeral disease or adhesive capsulitis.
Okay, Doc.
Now for the second composite test, this would be called the empty can test. Sir, can you please elevate your arms to 90 degrees and internally rotate your arms with your thumbs pointing down as if you're emptying a can. And please resist as I place downward pressure on your arm. Okay, sir, did you feel any difficulty doing this maneuver?
No, Doc.
Inability of the patient to hold the arm fully abducted at the shoulder level is a position test for a supraspinatus rotator cuff tear with a positive. I will now palpate for your olecranon process. And I will press over the epicondyles for tenderness, then I will palpate the grooves between the epicondyles and the olecranon process. where the synovium is most easily examined. Okay, thank you very much, Leo.
Go.
Now we will test for your elbows range of motion, which has flexion, extension, supination, and pronation. We'll begin with flexion. The primary muscles affecting these movements are your biceps brachii, brachialis, brachioradialis. Please bend your elbow. Okay, thank you. Now for extension, the muscles involved are triceps brachii and anconeus muscles. So can you please straighten your elbow? Thank you. Now for your supination, the biceps brachii and supinator muscles will be involved. So please turn your palms up as if carrying a bowl of soap. Thank you. Now lastly, for your pronation, muscles involved will be the pronator teres, pronator quadratus. Can you please turn your palms down? Okay, thank you very much, Leo. After injury, preservations of active range of motion and full elbow extension makes fracture highly unlikely, while full elbow extension has a sensitivity of 84% to more than 98% and specificity of 48% to more than 97%.
Game.
So now, sir, I will now palpate your wrist joints, anatomic snuff box, as well as your metacarpophalangeal joints. Okay, sir, I didn't notice any tenderness, bogginess, or any swelling. Did you feel any pain while I was doing that?
No.
Okay, Leo, will now perform the range of motion of your wrist. So we will do first the flexion, which involves the flexor carpi radialis and flexor carpi ulnaris muscles. Can you please, with your palms down, point your fingers towards the floor? Okay, thank you. For the extension, the muscles involved in this one is the extensor carpi ulnaris, extensor carpi radialis longus, extensor carpi radialis brevis. With your palms down, point your fingers towards the ceiling. Okay. So next is your adduction or the radial deviation. The muscle involved is the flexor carpi ulnaris. So with your palms down, bring your fingers towards the midline. Okay, very good. Lastly, the abduction. This will involve your flexor carpi radialis. So with your palms down, bring your fingers away from the midline. Okay, now to test the function of wrist joints, the finger flexors and the intrinsic muscles and joints of the hand, can you please grip the second and third finger? Okay, sir, thank you very much. You have a good grip strength. For any possible carpal tunnel syndrome, we will do 3 tests: thumb abduction, tunnel test, Fallon test for median nerve compression. Okay, now first we will do the thumb abduction. Okay, sir, can you please raise your thumb straight up as I apply resistance downward? Okay, weakness on thumb abduction is a positive test. Now for the tunnel sign, sir, I will start tapping lightly over the first of your median nerve in the carpal tunnel. Okay, do you feel any pain and numbness?
Nando.
How about aching?
Nando.
Okay, for the Fallon sign, can you please hold your wrist in flexion for 60 seconds with your elbows fully extended? Okay. Then, please press the backs of your both hands together for right angles. Okay, thank you. Do you feel any numbness and tingling when doing it?
Nando.
Okay, numbness and tingling in the median nerve distribution within the 60 seconds is a positive test for Fallon.
Okay, Doc.
Now to inspect your spine, I will first inspect your cervical, thoracic, and lumbar curves. Okay, then will you please face the wall, Leo, for me to be able to inspect the back of your spinal column and alignment of your shoulder for any possible scoliosis. Everything looks normal, Leah. Thank you. Okay, now we will do the spinal column range of motion. So first, we will do the flexion. Can you please bend forward while trying to touch your toes? Okay, thank you, Leo. Deformities of the thorax or forward bending, especially when the height of a scapula are unequal, it suggests scoliosis.
Game.
Now for extension, try to bend back as far as possible. Okay. Next is for rotation. Please relax. Okay. Lastly, for lateral bending, please stand to the side from the waist. Other side. Okay. Thank you very much, Leia. Everything seems to be normal. We will now assess the primary muscles of your hip by doing the hip range of motion. Please let me know if you notice any difficulty, pressure, or pain while doing these tests. We will now begin with flexion. The primary muscle affecting this movement will be your iliopsoas. Can you please bend your knees to your chest and pull it against your abdomen? Okay. Now for abduction. Lying flat, move your lower leg away from the midline. Okay, the muscles involved would be your gluteus medius and the gluteus minimus. Now for adduction, lying flat, bend your knees and move your lower leg towards the midline. The muscles involved with this one is the adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis. Now let's move on with external rotation and internal rotation. For external rotation, the internal and external obturators, quadratus femoris, superioris, and inferior gemeli will be involved. So while lying flat, please bend your knees and turn your lower leg and foot across the midline. Okay, thank you. Now for internal rotation, the muscles involved will also be the iliopsoas muscle. While lying flat, bend your knee and turn your lower leg and foot away from the midline. Okay, thank you very much. Now lastly for extension, can you please lie face down? Then try to lift your leg up. The muscle involved in that is the gluteus maximus. Okay, Leo, we are now down to your knees. I will first palpate for any swelling around your patella or any bugginess as well as warmth. This will point us to any possible synovial thickening or effusions of your knee joints or synovitis and non-tender effusions from osteoarthritis. Okay, thank you. Now, to test for your knee joint effusions, we will do the bulge sign for the minor effusions and the balloon sign for major effusion. We will first do the bulge sign. Okay, I did not notice any bulging or any fluid wave. Now to test for major effusion, we will now proceed with the balloon sign to check for palpable fluid waves. Okay, I didn't notice any fluid ejection or ballooning. Okay, the next test is the MAC mirror test. This is to help us in diagnosing the meniscus damage. Palpable click or pop along the medial or lateral joint line is a positive test for a tear of the posterior portion of your medial meniscus. Okay, thank you.
Go.
Now we will do the abduction and adduction stress test. The test to assess for your MCL injury and LCL injury. For any pain or gap in the middle joint is in line is a positive test for an MCL, and in the lateral joint is a positive test for LCL injury. Okay, thank you. Now to test for your anterior cruciate ligament, I will do the anterior drawer sign. Forward jerk showing the contours of the upper tibia is a positive test or anterior drawer sign. For ACL injury results from knee hyperextension, direct blows to the knee, and twisting or landing on an extended hip or knee. While for the posterior drawer test, this is to test for your posterior cruciate ligament. Any fall from your proximal tibia would be a positive posterior drawer test. First, the anterior.
Game.
Okay, I didn't notice any fall of your tibia back, so you do not have posterior cruciate ligament injury. Now to test for your anterior cruciate ligament rupture, we will do the Lachman test. Significant forward excursion is a positive test. Okay, thank you very much, Leo.
Okay, Doc.
Now for the last series of tests, we will do the ankle and foot range of motion. So first, we will do the ankle flexion, which would involve your gastrocnemius, soleus, plantaris, and tibialis posterior muscles. Can you point your foot towards the floor? Okay, thank you. Now for extension, the tibialis anterior, extensor digitorum longus, and extensor hallucis longus will be involved in this maneuver. First, point your foot towards the ceiling. Okay, thank you. Now for the inversion and eversion, this will involve the tibialis posterior and anterior muscles. And for the eversion, your peroneus longus and brevis muscles will be involved. Now for inversion, can you please bend your heel inward? Now for eversion, bend your heel outward. Okay, thank you very much. Now we are done with your musculoskeletal examination, Leo. There was a full range of motion in all your joints and of the upper and lower extremities. There were no evidence of swelling or deformities, and as you have said, there were no pain and pressure felt, right?
Yes, Doc.
So do you have any questions or clarification with all the things that we did?
None, Doc.
Okay, thank you very much.